Question 1. What is the primary reason for maintaining negative air pressure in the decontamination area of a central service department? A. To keep the area cool for instrument storage. B. To prevent the spread of contaminated air to other areas. C. To facilitate faster drying of instruments. D. To improve communication between staff members. Answer: B. To prevent the spread of contaminated air to other areas. This question tests your understanding of environmental controls in central service, specifically air pressure in decontamination. The key phrase, negative air pressure, indicates a safety measure designed to protect personnel and other departments. Negative air pressure means air flows into the decontamination area from adjacent spaces, effectively containing airborne contaminants like aerosols and microorganisms within that soiled environment. This prevents potentially harmful particles from escaping into clean areas or employee lounges, thereby minimizing the risk of infection. Think of it as a barrier that keeps the dirty air contained. Question 2. Which type of cleaning action uses high-frequency sound waves to create microscopic bubbles that implode, dislodging soil from instruments? A. Manual scrubbing. B. Impingement. C. Ultrasonic cleaning. D. Washer disinfector. Answer: C. Ultrasonic cleaning. This question focuses on the different methods used for instrument cleaning, specifically identifying the unique mechanism of ultrasonic cleaners. The keywords high-frequency sound waves and microscopic bubbles that implode are direct clues pointing to cavitation, the process that defines ultrasonic cleaning. This method is highly effective for removing fine debris from hard-to-reach areas and intricate instrument parts where manual cleaning might be insufficient. For example, jointed instruments or those with small crevices benefit greatly from ultrasonic cleaning, ensuring thorough removal of even microscopic soil. Remember, ultrasonic cleaners work by vibration, creating tiny cleaning bubbles. Question 3. What is the correct sequence for processing soiled instruments in the central service department? A. Decontamination, sterilization, assembly, storage. B. Decontamination, assembly, sterilization, storage. C. Sterilization, decontamination, assembly, storage. D. Assembly, decontamination, sterilization, storage. Answer: B. Decontamination, assembly, sterilization, storage. This question assesses your knowledge of the fundamental workflow of instrument processing in central service. The most crucial concept here is the logical and sequential order required to ensure patient safety and effective reprocessing. Instruments must first be decontaminated to remove gross soil and bioburden, then inspected and assembled, followed by sterilization to eliminate all microorganisms, and finally stored safely until needed. Skipping or reversing any step would compromise the sterility of the instruments, making them unsafe for patient use. Always remember that cleaning and decontamination come first to make instruments safe to handle before any further steps. Question 4. Which personal protective equipment, PPE, is generally required for employees working in the decontamination area? A. Surgical mask and shoe covers. B. Goggles, fluid-resistant gown, gloves, and face shield. C. Cloth scrubs and open-toed shoes. D. Standard uniform and name tag. Answer: B. Goggles, fluid-resistant gown, gloves, and face shield. This question tests your understanding of essential safety protocols, particularly personal protective equipment, PPE, necessary for high-risk areas like decontamination. The key concept is to protect oneself from potential exposure to bloodborne pathogens and other infectious materials. Goggles and a face shield protect the eyes and face from splashes, a fluid-resistant gown prevents contamination of clothing, and gloves protect the hands from direct contact. These items form a barrier against contaminants, which is crucial because decontamination involves handling soiled instruments. Always remember, proper PPE is your first line of defense against exposure to contaminants. Question 5. What is the primary purpose of a point-of-use cleaning or pretreatment of surgical instruments? A. To completely sterilize the instruments before transport. B. To remove all bioburden and prepare for immediate reuse. C. To prevent the drying of blood and tissue on instruments. D. To identify damaged instruments for repair. Answer: C. To prevent the drying of blood and tissue on instruments. This question focuses on the critical first step of instrument care, known as point-of-use cleaning. The concept is that delays in cleaning allow bioburden, like blood and tissue, to dry and harden onto instrument surfaces, making subsequent cleaning steps much more difficult and potentially less effective. Pre-treating instruments immediately after use, often with a moist towel or enzymatic spray, keeps soils moist and easier to remove during the main decontamination process. This small action significantly impacts the overall effectiveness of cleaning and ensures instruments can be properly reprocessed. So, always keep instruments moist until they reach decontamination. Question 6. Which of the following is considered a critical item according to Spaulding Classification? A. Blood pressure cuff. B. Stethoscope. C. Surgical instrument that enters sterile tissue. D. Endoscope used for a colonoscopy. Answer: C. Surgical instrument that enters sterile tissue. This question assesses your knowledge of the Spaulding Classification system, which categorizes medical devices based on the risk of infection associated with their use. The core concept of a critical item is that it comes into direct contact with sterile body tissues or the bloodstream, carrying a high risk of infection if contaminated. Therefore, such items must be sterilized to eliminate all microorganisms, including bacterial spores. Surgical instruments that penetrate the skin or mucous membranes fall into this category, unlike non-critical items like blood pressure cuffs or semi-critical items like endoscopes, which touch mucous membranes but not sterile tissue. Critical items require the highest level of reprocessing, sterilization. Question 7. What is the main function of an enzymatic detergent used in central service? A. To harden the outer surface of instruments. B. To break down proteins, fats, and carbohydrates. C. To polish instruments for a shiny appearance. D. To neutralize acidic residues on instruments. Answer: B. To break down proteins, fats, and carbohydrates. This question targets your understanding of cleaning agents, specifically enzymatic detergents. The key concept is that enzymes are biological catalysts designed to target and break down specific types of organic matter, which are the main components of bioburden found on soiled instruments. For example, protease enzymes break down proteins, like blood, lipase enzymes break down fats, and amylase enzymes break down starches. This enzymatic action helps loosen and dissolve tenacious soils, making them easier to remove during the cleaning process. Enzymatic detergents are essential for effective cleaning because they actively digest organic matter, not just loosen it. Question 8. What is the maximum temperature recommended for the final rinse water when manually cleaning instruments to prevent mineral deposits? A. 70 degrees Fahrenheit 21 degrees Celsius. B. 90 degrees Fahrenheit 32 degrees Celsius. C. 110 degrees Fahrenheit 43 degrees Celsius. D. Room temperature or cooler. Answer: D. Room temperature or cooler. This question tests your awareness of water quality and its impact on instrument integrity during the cleaning process. The concept here is that hot water, especially if it's tap water with minerals, can cause dissolved minerals, like calcium or magnesium, to precipitate out and leave water spots or mineral deposits on instruments as they dry. Using cool or room temperature deionized or distilled water for the final rinse helps prevent these unsightly and potentially damaging deposits, ensuring instruments remain clean and spot-free. Always remember that cooler final rinse water, ideally deionized, helps prevent spotting and mineral buildup. Question 9. Why is it important to rinse instruments thoroughly after cleaning with detergent? A. To ensure instruments are completely dry. B. To lubricate moving parts for better function. C. To remove detergent residues that could interfere with sterilization or cause patient reactions. D. To cool down the instruments before handling. Answer: C. To remove detergent residues that could interfere with sterilization or cause patient reactions. This question highlights a crucial step in the cleaning process: rinsing. The core concept is that even after cleaning, detergent residues can remain on the instrument surface. These residues are problematic because they can interfere with the effectiveness of subsequent sterilization processes or, worse, cause adverse tissue reactions if the instrument is used on a patient. A thorough rinse with treated water ensures all detergent is flushed away, leaving a clean surface ready for disinfection or sterilization. Think of it like washing dishes. You rinse them to remove soap so your food doesn't taste like soap. Question 10. Which method of disinfection destroys most vegetative bacteria, most viruses, and most fungi, but not bacterial spores? A. Low-level disinfection. B. Intermediate-level disinfection. C. High-level disinfection. D. Sterilization. Answer: C. High-level disinfection. This question requires you to distinguish between different levels of disinfection based on their efficacy against microorganisms. The key concept here is that high-level disinfection, HLD, is a powerful process that kills a wide range of pathogens, including mycobacteria, like the one causing TB, but it is not effective against all bacterial spores. Sterilization is the only process that reliably destroys bacterial spores. HLD is typically used for semi-critical items that come into contact with mucous membranes or non-intact skin, such as endoscopes. Always remember that HLD kills almost everything except bacterial spores, which require sterilization. Question 11. What is the purpose of placing a chemical indicator inside each sterile package or tray? A. To prove the item is sterile. B. To show the package has been opened. C. To indicate that sterilant has penetrated the package. D. To measure the exact temperature inside the sterilizer. Answer: C. To indicate that sterilant has penetrated the package. This question addresses the important role of chemical indicators, CIs, in quality assurance for sterilization. The core concept is that CIs are designed to react to specific sterilization conditions, like steam, temperature, and time, and change color, indicating that the sterilant agent has reached the inside of the package or tray. They do not prove sterility, as sterility can only be assured through biological indicators and a validated process. Instead, they provide immediate visual confirmation of proper sterilant exposure within the package. Think of it as a safety check that tells you the sterilizing agent got where it needed to go. Question 12. Instruments with lumens, such as endoscopes or suction tubes, require special attention during cleaning primarily because A. They are easily scratched. B. Their internal channels are difficult to clean and dry. C. They are very expensive. D. They cannot be immersed in water. Answer: B. Their internal channels are difficult to clean and dry. This question focuses on the challenges associated with cleaning complex instruments, particularly those with lumens. The concept is that the narrow, internal channels of these instruments can harbor significant amounts of bioburden and are hard to access for manual scrubbing or thorough rinsing. If not meticulously cleaned, dried, and disinfected/sterilized, These channels can become breeding grounds for microorganisms, posing a significant infection risk. Special brushes, flushing devices, and specific cleaning protocols are essential to ensure these intricate pathways are free of debris. Always remember to pay extra attention to lumens. They are hidden pathways for contamination if not cleaned properly. Question 13. How should soiled surgical instruments be transported from the operating room to the central service decontamination area? A. In an open tray on a cart. B. In a clean, uncovered basin. C. In a closed container or cart designed for transport of soiled items. D. Carried by hand by a single staff member. Answer: C. In a closed container or cart designed for transport of soiled items. This question tests your knowledge of safe transport protocols for contaminated items, a critical aspect of infection control. The core concept is to prevent exposure to healthcare workers, patients, and the environment during transit. Soiled instruments can shed contaminants, including blood and other body fluids. Using a closed, leak-proof container prevents spills, reduces aerosolization, and contains any odors, ensuring a safe transfer from the point of use to the decontamination area. Never transport soiled items openly. Containment is key to preventing cross-contamination. Question 14. What is the purpose of conducting a leak test on a flexible endoscope? A. To check the scope's imaging capabilities. B. To identify any damage or punctures in the outer sheath before reprocessing. C. To measure the internal pressure of the scope. D. To determine if the scope needs lubrication. Answer: B. To identify any damage or punctures in the outer sheath before reprocessing. This question highlights a crucial step in the reprocessing of flexible endoscopes. The concept of a leak test is to submerge the endoscope in water while pressurizing its channels with air. If there are any punctures or tears in the scope's outer sheath, air bubbles will be seen escaping from the damaged area. Detecting these leaks before manual cleaning and high-level disinfection is vital because fluid intrusion into the internal components during reprocessing can cause irreparable damage and compromise the integrity of the scope. A leak test helps protect the scope from further damage and ensures proper function. Question 15. The term bioburden refers to A. The amount of chemicals left on an instrument after cleaning. B. The number of microorganisms on a contaminated object. C. The weight of the instrument tray. D. The total number of sterile items in storage. Answer: B. The number of microorganisms on a contaminated object. This question defines a fundamental term used in infection control and sterilization. The concept of bioburden specifically refers to the living microorganisms present on an item before sterilization or disinfection. Understanding bioburden is crucial because the effectiveness of any cleaning, disinfection, or sterilization process is directly related to the initial number and type of microbes present. A higher bioburden makes it more challenging to achieve complete sterility, emphasizing the importance of thorough cleaning as the first step in reprocessing. Less bioburden means a more effective sterilization process. Question 16. What is the minimum frequency for cleaning the walls, floors, and work surfaces in the decontamination area? A. Daily. B. Weekly. C. Monthly. D. After each shift or when visibly soiled. Answer: D. After each shift or when visibly soiled. This question addresses the crucial aspect of environmental hygiene in the decontamination area. The concept is that surfaces in this high contamination zone must be cleaned frequently to prevent the accumulation of microorganisms and to maintain a safe working environment. Visibly soiled is a key clue, indicating that cleaning should occur immediately whenever dirt or spills are present, regardless of a set schedule. This frequent cleaning helps reduce the risk of cross-contamination and ensures a consistently clean workspace for reprocessing activities. Clean surfaces are essential for a safe working environment. Question 17. How should instruments with multiple parts, e.g., scissors, needle holders, be handled during decontamination and cleaning? A. Left assembled to ensure all parts are cleaned together. B. Disassembled as much as possible to expose all surfaces. C. Immersed in solution without any manipulation. D. Placed directly into the ultrasonic cleaner assembled. Answer: B. Disassembled as much as possible to expose all surfaces. This question focuses on proper cleaning techniques for complex instruments. The core concept is that bacteria and debris can hide in crevices and under surfaces that are covered when an instrument is assembled. Disassembly, where possible, allows cleaning solutions and mechanical action to reach all internal and external surfaces, ensuring thorough removal of bioburden. For example, jointed instruments should be opened and ratchets released to ensure every part is exposed to the cleaning process. Always remember to open wide or take apart instruments to clean every nook and cranny. Question 18. Which type of water is generally preferred for the final rinse of instruments to prevent spotting and corrosion? A. Tap water. B. Softened water. C. Deionized or distilled water. D. Well water. Answer: C. Deionized or distilled water. This question emphasizes the importance of water quality in the instrument reprocessing cycle. The concept is that regular tap water contains minerals, like calcium, magnesium, iron, and impurities that can leave spots, streaks, and even cause corrosion or pitting on instrument surfaces, especially after drying. Deionized or distilled water has these minerals and impurities removed, preventing such issues and ensuring instruments are left pristine and free from waterborne contaminants after the final rinse. Using pure water for the final rinse helps maintain the longevity and appearance of your valuable instruments. Question 19. What is the primary purpose of tracking the usage and reprocessing cycles of flexible endoscopes? A. To determine staff efficiency. B. To ensure proper maintenance, repair, and eventual replacement. C. To identify the specific patient an endoscope was used on. D. To monitor the amount of detergent being used. Answer: B. To ensure proper maintenance, repair, and eventual replacement. This question delves into the importance of comprehensive record-keeping for complex and delicate instruments like flexible endoscopes. The core concept is that these instruments have a limited lifespan and can degrade over time with repeated use and reprocessing. Tracking their cycles helps facilities monitor their wear and tear, identify when maintenance or repair is needed, and determine when they are nearing the end of their useful life, ensuring timely replacement. This proactive approach prevents instrument failure during procedures and ensures patient safety. Tracking is vital for managing the lifespan of expensive and critical equipment. Question 20. When should enzymatic detergents be used in the decontamination process? A. Only for instruments used in orthopedic surgery. B. As a pre-soak or during manual cleaning. C. After instruments have been sterilized. D. To clean sterilizer chambers. Answer: B. As a pre-soak or during manual cleaning. This question asks about the appropriate application of enzymatic detergents. The concept is that these specialized cleaners work best when given time to interact with organic soils, typically during the initial steps of decontamination. Using them as a pre-soak allows the enzymes to begin breaking down bioburden, making subsequent manual or automated cleaning more effective. They are active at lower temperatures, making them ideal for pretreatment where instruments are still grossly contaminated. Enzymatic detergents are your first line of attack against stubborn organic material. Question 21. What action should be taken if a sterile package is found with a tear or hole? A. Re-sterilize the package immediately. B. Use the instrument but notify the supervisor. C. Consider the package contaminated and send it back to decontamination. D. Apply tape over the tear and place it in storage. Answer: C. Consider the package contaminated and send it back to decontamination. This question presents a common scenario that tests your understanding of maintaining sterility. The critical concept is that any breach in a sterile barrier, such as a tear or hole, compromises the sterility of the contents. Once the barrier is breached, microorganisms from the environment can enter, rendering the item unsafe for patient use. Therefore, the package must be considered contaminated and sent back to the decontamination area to undergo the full reprocessing cycle: cleaning, inspection, packaging, and sterilization. Again, a compromised package means a compromised instrument. When in doubt, send it back to be reprocessed. Question 22. What is the primary purpose of brushing the lumens of endoscopes during manual cleaning? A. To polish the internal surface for better visibility. B. To apply lubricant to the channels. C. To mechanically remove bioburden and debris from the inside walls. D. To dry the channels thoroughly. Answer: C. To mechanically remove bioburden and debris from the inside walls. This question focuses on a specific, vital step in endoscope reprocessing. The core concept is that lumens, being narrow and often irregular, accumulate significant amounts of blood, tissue, and other contaminants that cannot be easily flushed away by water or enzymatic solutions alone. Brushing provides the necessary mechanical action to physically dislodge and scrub away this stubborn bioburden from the internal surfaces, ensuring they are thoroughly cleaned before disinfection or sterilization. Brushing is essential for getting the inside clean, where contaminants love to hide. Question 23. In the central service decontamination area, what type of air pressure is maintained to ensure contaminants are contained? A. Positive air pressure. B. Negative air pressure. C. Neutral air pressure. D. Variable air pressure. Answer: B. Negative air pressure. This question revisits a critical safety feature in the decontamination area. The concept is that negative air pressure is designed to draw air into the decontamination room from adjacent, cleaner areas, and then exhaust it directly outside after filtration. This prevents potentially contaminated air from flowing out of the soiled area into other departments, thereby protecting staff and preventing cross-contamination. It's a fundamental engineering control for containing hazards where they originate. Remember, negative pressure keeps the dirty air in the dirty room. Question 24. What is the recommended method for cleaning delicate instruments with fine lumens, such as those used in ophthalmology or neurology? A. High-pressure steam cleaning. B. Ultrasonic cleaning. C. Manual cleaning with soft brushes and gentle flushing. D. Abrasive scrubbing with strong detergents. Answer: C. Manual cleaning with soft brushes and gentle flushing. This question addresses the specific care required for very delicate instruments. The concept is that while automated methods like ultrasonics are powerful, extremely fragile instruments, especially those with very small lumens, can be damaged by aggressive mechanical action or high-frequency vibrations. Manual cleaning with specialized, soft brushes and gentle flushing techniques allows for meticulous removal of soil without risking damage to the instrument's delicate structure or fine channels. For instruments that are easily damaged, gentle manual care is often the best approach. Question 25. What is the primary reason for proper drying of instruments after cleaning and rinsing, especially those going to sterilization? A. To prevent rusting and corrosion. B. To make them lighter for handling. C. To ensure they fit correctly into sterilization trays. D. To allow for easier assembly. Answer: A. To prevent rusting and corrosion. This question focuses on a critical step immediately following cleaning. The core concept is that residual moisture, particularly if instruments are not dried properly, can lead to water spots, rust, and corrosion, even on stainless steel instruments. Furthermore, moisture can interfere with the effectiveness of some sterilization methods by acting as a barrier or by promoting microbial growth. Thorough drying, whether by air, lint-free cloth, or forced air, is essential to maintain instrument integrity and ensure successful sterilization. Always make sure instruments are dry to prevent damage and ensure proper sterilization.